Hi, good afternoon, everyone. My name is JD Devgan, your MLA for McPhillips. Before we begin, I'd like to begin with a land acknowledgement. We are gathered on the territory of the Anishinaabe, the Ininuak, the Dene, the Dakota, the Inuit, the Anishinaabe Nations, and the Red River Métis Nation, who all paved the way for what is known as Manitoba, home to all treaty people. We are here today to mark an important step in making healthcare more accessible. To share more about the announcement, please welcome the Premier of Manitoba, the Honourable Wab Kinew.
Awesome, thank you. Okay, thanks everybody. I wanted to begin by sharing that earlier today I spoke to Governor Tim Walz of Minnesota. And that's after having texted with him and his Lieutenant Governor, Peggy Flanagan, last week, pretty much immediately following the terrible tragedy that took place there. So when I had a chance to speak to Governor Walz today, first off, I let him know that we here in Manitoba support our neighbors. We want to be good neighbors here in the north. And of course, we just want to see what's happening down there stop. There's so much confusion and so much violence. We just want to see things for our southern neighbors get back to normal. And I offered whatever assistance we can provide, and of course the sense of solidarity that we can send down to our American friends and in many cases family. I know that the loss of a life, to see a mother killed in this fashion, is just terrible. It really pulls at the heartstrings. And we don't want to see these things like this happen. We want all this to end. And regardless of where you stand on immigration, regardless of where you stand on Trump, I think everyone agrees that seeing a mother have her life taken in such a way is just wrong. And so let's just find a way to help our American neighbors make it through this difficult period in that country so that we can get back to a more positive way of life. And I will be very clear for Manitobans, this is not something to be flippant about. And, I think the Manitoba PCs will have some explaining to do on that front. But for the rest of us, for the average person here in Manitoba, the vast majority of Manitobans, I think now is maybe a good time to check in on your American friends and relatives. There's so much going on, even just in the few weeks that we've had of this new year so far. Just offering that support, I can tell you it meant a lot to Governor Walz to have our province reach out and offer support. I think if you could do the same to American friends and relatives, that would be greatly appreciated. And so, yeah, please do reach out, offer support, and thank God we're Canadian, and we're going to keep it that way. So, the news of the day, we're moving from paper to plastic, and now we're moving from plastic to pixels. You can now get a digital health card. I did mine last night. I just unlocked my phone, and using a secure process, that's how long it took me to pull it up. You got a QR code on it. You can't see my PIN number because it's hidden when you initially unlock it, so there's privacy and all sorts of other features being looked at. But this is just another way that we're modernizing healthcare to meet the needs of you and your family. We've been adding clinics right across the province that are open late into the evening, that are open on the weekends. We've been bringing in the plastic health cards so that people who want to get rid of the paper health cards can do so. I know there's some nostalgia. Some people like the paper health cards because all your kids are on there. That's fine. Keep it that way. But for everyone else who was thinking, it's time for Manitoba to move into the 1980s technology-wise, well, hey, we brought forward the plastic health card. Now, some could argue we're moving into the 2000s, maybe even the 2020s with the introduction of digital health cards. So there's a lot of catch up you have to do after the PCs cut healthcare for many years. We're here for it. We're putting in the work. So you can book an appointment online to see a doctor and a nurse practitioner near you. You can use a digital health card to do so starting at 5 p.m. today. And this is all part of making sure that healthcare is there for you and your family when you need it. So plenty more to share about this important announcement. But for now, good news. You got the beautiful health card now in digital form. So thanks to everybody in Manitoba Health and Shared Health who've made this happen. Miigwech merci. Thank you very much.
Thank you so much, Premier Kinew, for all your work on fixing Manitoba's healthcare and bringing us into the 21st century. I know I'm a big fan of this move. Next, I'd like to welcome Minister of Health, Seniors and Long-Term Care, Uzoma Asaguera, to speak.
Thanks, JD. Thanks so much.
Start that.
Good afternoon, everyone. As you heard from the Premier, today we are launching Manitoba's digital health card, which means Manitobans can now carry their health card securely on their phone through a Manitoba Health wallet. This is a big deal. This has taken a lot of effort and teamwork to get here. And I want to start by saying thank you so much to Manitobans for advocating for this, for the modernization of healthcare in this province. And I want to thank our team in Manitoba Health who have been working so hard to not only start by clearing the backlog that was handed to us by the PCs. Over 25,000 Manitobans were waiting for health cards when we came into government, and our team worked very, very hard in health to clear that backlog, and they've done incredible work to modernize healthcare in this province, and this is another step. You know, when we came into office, Manitobans made it really clear they were tired of the old paper, flimsy, coffee-stained health cards they were carrying in their wallets. They wanted to see a change, so we've gone from paper to plastic to pixels because we know that Manitobans deserve better. The launch today builds on, like I said, a lot of work, but it's also something that is speaking to what the future of healthcare in this province is going to look like. For parents, this step today means one less thing that you got to keep track of in your lives. Instead of juggling multiple cards for your kids, you can have them all in one place, right on your phone. If your child gets sick or gets hurt, you don't have to stop and think on your way out the door to the hospital or wherever you're going, the clinic. Did I get the health card? Do I have that health card with me in my wallet? This really does matter in cases of emergencies, maybe during evacuations, including wildfires. We know many communities lived through this past summer. People often had to leave their homes or their settings very quickly without that moment, that opportunity to grab and gather all of their documents. So having access to your health card on your phone makes one small part of an already difficult situation or a health emergency just a little bit easier for families in this province. And this isn't just about the format, right? This is about giving people more choice. It's about giving people more agency. We heard from Manitobans that they want to have a say in how they access healthcare and how their personal health information is disclosed. That is why we moved sex from the health card so that individuals can decide what they share rather than have it automatically displayed or assumed. This also helps healthcare workers. We're piloting QR code scanners in hospitals right now so that staff can scan instead of having to manually type in information for each and every person. The QR code allows for them to scan it. It's automatically there right on their computer screen so they can keep the process moving quickly. It's faster, it reduces errors, and it means more time doing what healthcare workers want to do and what they do best, and that's focusing on patient care. At the end of the day, this is about removing small barriers that cause pretty big stress. It's about making sure that you can access care no matter where you are without having to remember that piece of paper. And it's one less thing that Manitobans have to worry about. So this is an important step today. It's part, again, of our government modernizing the healthcare system in this province. And it's something Manitobans can be really proud of as we continue to take more steps in the coming weeks and months. Thanks so much. Almost forgot, this is a really exciting part. So now we're actually going to go to a live demo of getting your digital health card right over to my left.
Okay.
Maybe I should talk about this. Okay, so I'm going to maybe talk about what's happening here. It's a little drab otherwise. So as you can see it, and I'm just going to be honest, and the Premier's already done this. It works. As you can see, it works. So you go to the platform, you go to your Manitoba wallet, right? And you can see you've got all of the obvious registration details you need. beautifully laid out for you right here. You've got this great QR code. The digital card looks like the physical plastic cards that you have with those beautiful northern lights. It's got all the essential information that you need here. This is the card, the digital card in your digital wallet that automatically gets uploaded at the piloted sites across healthcare facilities in this province. Everything you need is right there. It's very, very clear. And the bonus here for parents, because we know we've heard this, right, is that you get your kids' cards also attached. That's huge. So you're not having to carry multiple cards. This is making sure that all of that information is right there, a part of your digital wallet in one place. So this is the site itself. As the Premier stated, we're going to be fully live by 5 this evening. It's a great step in the right direction for healthcare in this province. And it's super easy. It takes no time whatsoever, and then you've got it right on your phone. Okay.
Right on.
Okay. Thanks.
That was a great demo. Thank you so much, Minister. This is really exciting. I'm going to be waiting right at 5 o'clock to sign up myself. Now I'd like to welcome Stephanie Nunez to share some words.
Hi everyone, I'm Steph Nunes. I'm a mom of 2. I work as a nurse at St. Boniface Hospital, and I'm an instructor at the University of Manitoba as well. And today I've got my 2-year-old with me, which honestly says a lot about why this option matters. When I heard about the digital health card, my first thought was, oh, that would make things actually a lot easier. I'm always trying to remember a million things, and health cards are one of those things you don't think about until you really need them. So being able to have my card and my kid's card on my phone just feels practical, it makes sense, and it's one less thing to keep track of. Between work, childcare, and moving between places all day, I don't always carry the same bag, but I do always have my phone. From a nursing perspective, I know how busy intake areas can be, and if scanning a card means less paperwork and fewer chances for mistakes, that's a win for everyone. As a parent, I'm really looking forward to having this option. Thank you.
Tiago did a great job too. Well, thank you all for being here. Thank you to our speakers and our guests here to mark this milestone. I believe now we are opening it up to questions from the media.
Minister, how long will it take to digitize health records, and what's the latest estimate for the cost of that?
Sure. So again, today we're celebrating this really big and important milestone of having digital health cards. But we recognize that this is just yet another step of really modernizing the healthcare system. So we went from paper cards and a backlog of 25,000 Manitobans waiting for months to get their card to plastic health cards and a good window of targeted timelines to get your card in a reasonable amount of times. And now we're taking that step to digital health cards that benefit not only individuals, but of course, as you've heard here today, entire families and healthcare workers. So the next steps that we're looking at here are, again, some more enhancements to the digital health card and the digital wallet. Beyond that, we're then going to be taking steps to ensure that folks can access their lab work on their digital platforms. This is a step that we've talked about, quite a while ago, actually, with the Dynacare contract. So when we talked about the Dynacare agreement, what we built into that agreement were not only standards which didn't exist previously under the previous government, but we also made sure to build in some enhancements in terms of modernizing the way that patients can access their records. So that's going to be one of the next steps that we take, is that folks will be able to access their lab work through Dynacare on the platform.
Thank you, Minister. How many more years, like by what year do you expect all digital records will be digitized?
That's the goal of our government in terms of electronic medical records is a big one, as folks, I think, are well aware of. So our goal is to have a provincial electronic patient record system by 2027. In conjunction with, of course, having a digital wallet, with having the ability to access your lab records, and then going from there. As you can imagine, Manitobans have been very clear. They not only want access to their records, but they want their information to be protected. And so every step of the way, we need to make sure we do our due diligence, that we're being very methodical about protecting health information and doing this in a sustainable way.
And what's the projected cost of digitizing all these records? We've heard in the past some pretty heady estimates. I know it's not simple dozens of organizations to coordinate, but how much will it cost, do you figure?
You know, that's a number that we can look at getting you offline. What I can tell you is that every single year in our budget, we have allocated dollars specific to modernizing the healthcare system. So every single year in our budget from day one, our government has built in capacity to make sure that we're taking steps in the right direction to modernize and digitize the healthcare system. And we've actually got a plan in place. We've put governance in place. We've put, again, agreements with partners like Dynacare in place. None of this existed prior to us. This was all work that we had to stand up under our administration, under the leadership of Premier Kinew, giving health the authority and the direction to go out and do this work. So it's taken us quite a bit of time to catch up in some ways, but we want to do more than catch up. We really want to be a leader in terms of Manitobans having a modernized healthcare system and patient records.
And does this digital card can it go into a Apple or Google wallet?
It's going to be in its own Manitoba Health wallet.
Is there a security issue with it being in an Apple or a Google wallet?
It's security and the protection of Manitobans' healthcare information is our top priority, and it's important that we do this work in a platform that prioritizes that. So having our own digital wallet allows for us to take those precautions.
I asked this because the question I'm already getting is, can I just slide that into my little thingy where I have my, my bus pass and
That's right.
concert tickets,
Yeah.
whatever people have?
Yeah, the answer to that is no. You're going to have your own Manitoba enhanced digital wallet, which is great. It makes sure that we're prioritizing the safety and security of your health information. I personally think it's pretty cool that you're going to be able to have your own Manitoba specific information in its own wallet. That's an advancement that I don't think anybody, I think most folks didn't believe was possible in this province based on many years previous of no work being done in this space. But in 2 years, we have made leaps and bounds in modernizing healthcare in this province. It's something to be very proud of. The health department, the health team has worked tirelessly to get us here, and we're going to keep doing this work so that Manitobans have more to look forward to in terms of the enhancements in their healthcare system.
Minister, are there other types of identification that you guys are kind of eyeing this at, or what can Manitobans expect that way?
I probably asked the Premier to speak to this. More so what I can say is that this is really across departments. We've got the Department of Minn, right, led by Minister Walz, that's really doing a lot of the heavy lifting on this and looking across government to see other opportunities, but probably ask the Premier to speak to that.
Yeah, for sure. So unlock my phone. It's hooked up to the Face ID thing, and then you can access the digital health card as of 5 o'clock today. In the coming months, hopefully not years, coming months, hunting and fishing licenses you'd be able to store in this wallet. Timber permits, so when you're going to go cut wood for your logging operation, you can make sure that you got that permit in the Manitoba wallet. But the minister makes a great point about safety and security. So team's done a lot of work on making sure your private health information is going to be protected and secured. A couple mop-up question answers preemptively, maybe 1.9 million in terms of the cost of getting the digital health card. And for all the conspiracy-minded folks who are running to their YouTube channels, stop. This is not mandatory. We're not making you get a digital ID. Totally optional. It's up to you. If this is going to make your life easier, get a digital health card. If you prefer the plastic health card, that's still there. And if you just like the paper card, which I only found out today, apparently a lot of people are nostalgic for, you can do that too, I guess. So a bunch of options just to make your life easier. Book an appointment to see a doctor online. Use your digital health card. Manitoba's government is starting to serve you the way that you expect in our contemporary society.
There was a mention of a pilot project for QR code scanning at hospitals. Can we learn a little bit more about that pilot project? When did it start? Where is it in place? And kind of, how long will it take and what's next?
Yeah, it started earlier, I guess last year at this point. I think there's 5 sites across the province, including here in Winnipeg, but also at many rural sites, Dauphin, Selkirk, rural hubs, I should perhaps say, just to be specific. And the idea is we'll keep rolling this out. You heard, I thought, a great point that if, at intake, this makes people's lives easier. I think that benefits everybody. Let's reduce the administrative burden on nurses, on other people working in the healthcare system. Let's speed things up for patients. Sounds like a win-win. That's what happens when we bring government out of the dot matrix printer age and into the smartphone age. Yeah. Yeah. OK. Aujourd'hui, nous sommes ici pour annoncer la carte de santé pour les Manitobans et Manitobaines. C'est un nouvel arrangement que nous sommes très fiers de. Depuis maintenant, aujourd'hui à 5 heures, nous serons la deuxième province après l'Alberta qui a cette fonctionnalité. Tu pourrais télécharger votre carte de santé. Et puis, ça vous aide en tant qu'un parent, en tant qu'un membre de famille, mais les infirmières et les autres qui travaillent dans le système de santé pourraient profiter de cette opportunité aussi.
You said your opening comments that the Manitoba PCs have been explaining to me. Look at comments. What specifically were you referring to?
The Manitoba PC board member and presumptive candidate in one of the ridings in our province made some comments about ICE in Manitoba. Nobody in Manitoba wants to see that. I mean, both the sort of action that we saw in Minneapolis that saw a mother lose her life, but also about the sort of commentary being brought into our provincial politics that would just demean and cheapen a serious issue like this. So, I was speaking to Governor Walz today and have been, in touch with him and his lieutenant governor since this terrible tragedy happened, and it really just puts things into perspective that we want a maturity and a sincerity in politics, regardless of where you are in the political spectrum, that respects people's lives. And when you see a mother killed, I think it should make everyone pause and bring out their best. Unfortunately, though, from the PCs, we've seen it's brought out their worst. And I think we all know that if we're in the middle of an election campaign, you guys would all be asking how quickly are they going to drop this person? Okay, well, it's up to them to answer that. What I would say on a more substantive and more serious level is this. When you're talking about campaigning and politics at the provincial or federal or whichever sphere, you're really talking about who is fit to lead a government and who has the maturity to make decisions on behalf of the public interest. And right now, when you have a political party in Manitoba called the PCs who are treating the loss of a mother in a neighboring jurisdiction as something to get a couple of likes on Facebook for, well, you got a pretty clear illustration that they're not ready for government. On our side of the ledger, we stand with our neighbors in Minnesota and across America. We want this to end. We want this whole period of chaos in the United States to end. I don't know if I had on my 2026 bingo card that I'd be agreeing with something Jesse Ventura said, but hey, Jesse Ventura said recently that America is becoming a third world country when they have military police operations taking place in large cities. He's not wrong. That is something that should cause all of us concern. And again, you can be wherever you are on the political spectrum. You can be a true blue conservative, you can be a real life progressive, but all of us should agree on the sanctity of human life. All of us should support democracy, and all of us should be concerned by what we're seeing happening in Minnesota. And so we want to see our neighbors make it through this period in a healthy, holistic, and strong way, because we benefit when the American people are doing well here in Manitoba, but we can't see them continue down this road that they're currently on. And so check in on your American friends and family. Let's keep working to push the American people and their administration right now, first off of tariffs, and then maybe also off of the subversion of Western liberal democracy, and let's just try to make life what we want it to be, which is your kids can grow up with peace and security and opportunity. I think that we just need to bring it back to first principles. And we're doing what we can here in Manitoba, little things to make your life easier. But of course, when it comes to things like democracy, when it comes to the life of a mother, like these are not things that we take for granted. And you look at the Manitoba PCs, when the tariffs were implemented, their leader, trying to be funny, I guess, thanked Donald Trump for the tariffs. Now you've seen a mother lose her life in Minnesota, and one of their candidates and party board members is trying to make a joke for likes on Facebook. This is not a serious political operation. And so I'm calling them out because they need to do better. And they have a legitimate role as the opposition, but you know, it kind of puts a little bit of a mark on our great province of Manitoba if the opposition is running around making comments like this at the same time that we, the serious people in government, are trying to say, you know what, Governor Walz, you know what, people of Minnesota, we got your back. We're standing with you in solidarity. We're going to support you through this difficult period. So again, American people got some stuff to work on. Manitoba PC Party got some stuff to work on. We're here working for you. We're going to keep improving healthcare. We're going to help you with the cost of living while we're at it.
Interesting to say the American people have stuff to work on. That implies people have a say still down there. You believe they still do have a functioning liberal democracy at the federal level.
We got to see turnout in the midterms. I think one of the things I've seen in my life is that the franchise is one of the most powerful things that any of us have. When my father was a young man, he did not have the right to vote in this country. And now, not only do I get the opportunity to serve as premier, but if you just look at the progress, like don't get me wrong, for sure there's a lot of challenges for Indigenous people out there, but there's no denying that progress has been made since Indigenous people had the right to vote recognized in Canada. That is a very clear illustration of the progress you can make. When we look at Minnesota, people have the right to protest. People have the right to speak out on social media, whichever way you want to put it, by the way. If people want to support or people want to talk about why they like Trump, they're free to do so. But what matters is you have to turn out to vote. Put your money where your mouth is by turning out to vote. The midterms are going to be very important. Of course, we in Canada are cheering on the midterms because we have this whole tariff situation going on. But the American people have the opportunity to say, we don't want a militarized police force in our streets acting with impunity. The American people in the midterms have the opportunity to say, we don't want this over-the-top caricature of government that we see sometimes, where maybe it seems like some officials are more concerned with playing dress-up than meeting and addressing the needs of the people. And maybe the American people also have the opportunity to say, you know what? The cost of living matters to me, but so does being the defender of human rights around the world. And I want a government that can walk and chew gum and do both. Deliver on the cost of living, which Trump has not been good at, let's be clear, but is also going to defend the liberal, democratic, Western world order. And yeah, no, I mean, like we could talk for hours and hours about this thing. I'm sure everyone in this room has a lot of thoughts, but the fundamentals are somebody lost their life. This ought to be a wake-up call, and if you are wondering what you can do in Canada, it is reach out to your friends and family in the States and let them know we got their backs. And if you are somebody who can vote in an American election, then please do so and help return America back to what we want to see from our southern neighbors.
Is the comment, pardon me, the Facebook post that you're referring to, is that made by Patrick Aller?
Yeah.
Okay.
Yeah, correct.
And then beyond solidarity for people here in Manitoba, and maybe for the Manitoba government specifically, is there anything more that we can do for Minnesota? Did anything like that come up in your conversation with Mr. Walz? Is there anything he's asking for?
Governor Walz was very clear to Manitobans and to Canadians, keep speaking up. Keep speaking up is what he said. Like, we have to be cognizant our American friends and relatives want to have a zone of respect around their democracy, the same way that everyone in this country hated that 51st state talk, the same way that we want people in America to respect our democracy. But that said, sometimes your neighbor's saying, you know what, what's going on there isn't right. might be that nudge or that message that somebody needs to hear. So Governor Walz is leading his state through a heck of a time right now. They've lost somebody in very tragic circumstances. There's a lot of uncertainty what's going to come next. And I would just encourage folks here to heed Governor Walz's message, which is keep speaking up. You know, the right to the franchise is one of the things we have in a democracy. The right to freedom of speech is another. And for those of us in elected office, we of course have a responsibility to consider the public good when we exercise our duties and rights.
Different topic. International student enrollment is down in universities. Do you have plans to help out?
The federal government has cut the number of international students, and it is causing a lot of headaches for colleges and universities here in Manitoba. We're going to work with them, and I'd say at this point we're still just trying to see clearly what the impact is. I think in the past week we've seen one of the colleges in town 40% or more cut. You can't make that up with a taxpayer subsidy. You're talking about a fundamental change to a school's operating environment. So we're gonna be there to keep working together and figure out how we're gonna make our way forward in light of the cuts that the federal government has made.
The immigration changes have resulted in a real population drop in Manitoba in Q3, according to stats count of 2,000 people. That might not sound like a lot, but that's significant for Manitoba historically. What is the province going to do in addition to the P&P changes, the P&P stimulation you've spoken about, to try to reverse the declining population trend?
Yeah, we got a great Minister of Labour and Immigration, Malaya Marcelino, who's always pushing for more PNP spots. She was successful in getting some of the federal cuts to our immigration numbers reversed. But I think the big plan is grow the economy, and let's grow Churchill. So we all saw what happened with Venezuela and the U.S. at the start of the year. There's been a lot of concern about what that's going to mean for Alberta's oil patch. Is it going to result in downward pressure on that spread between Alberta oil exports and what the price per barrel is out there? And what I would say is this: Churchill. If we can get Western Canadian resources to international markets, then we have more of a buffer. We have more resilience in the face of not only actions that the American government might take, but also resilience against price shocks, potential price shocks. We haven't seen them yet, to be clear. So again, I think that when we talk about growing the population, folks in Canada are going to they're going to go to where the opportunity is. And we are working hard each and every day to create the opportunity. Right now, we have this amazing chance with the interest in Hudson Bay to bring a generational economic opportunity. We got to respect the environment, particularly the local impacts, the wildlife. We got to look at that. But I'm convinced that there is a way that we can open up this opportunity to drive economic growth in Manitoba. And when we look at this time of Canada trying to figure out how we're going to safeguard our economy from the chaos that we're seeing in America right now, I think in the future historians will write the story of how Manitoba stepped up. And in large part, it'll be because of Churchill and Hudson Bay.
If you could just cue to Zoom, we have some questions.
Okay, we got some questions on Zoom, which we're happy to go to now.
Thank you, Premier. Two reporters on Zoom. We'll start with Catherine Moreau from Radio Canada. Catherine, one question, one follow-up.
Hi, Premier. I had a question concerning Pimachowak. Obviously in French. I know you went there last week. J'aurais aimé avoir vos impressions. Qu'est-ce que vous avez constaté sur place et comment vous êtes senti lorsque vous avez observé l'état des lieux?
Il y a beaucoup de monde qui sont frustrés. Et puis, c'est à cause d'un grand défi pendant, juste après Noël et puis la nouvelle année où beaucoup de monde ont vécu une situation très difficile. Alors, je comprends les frustrations et puis nous sommes là en tant que la province du Manitoba pour les appuyer. Nous avons appuyé là dans les premières heures, les premiers jours. Nous sommes aussi là aujourd'hui pour les appuyer. Nous avons appuyé pour cet appel pour les forces armées canadiennes. Alors, nous serons là pendant cette situation d'urgence, mais aussi après pour leur aider de trouver un avenir plus sécuritaire dans Pimachowak et puis Cross Lake.
Mon follow-up, ce serait justement comment est-ce que vous allez faire ça pour rendre les choses plus sécuritaires là-bas, c'est-à-dire aussi, puis pour que des événements comme ça ne se reproduisent plus, là, les problèmes d'électricité.
Oui, alors il y a des réponses courtes et long terme. Il y a la communauté de Cross Lake, et puis ça c'était une communauté qu'on dirait c'est dans la juridiction provinciale. Et puis là, ils n'ont pas perdu leur eau à cause du fait que le gouvernement provincial avait une autre source d'électricité. On n'a pas vu ça sur la Première Nation. Le gouvernement fédéral n'a pas investi dans la même sorte d'infrastructure. Alors, je pense qu'on doit travailler ensemble en tant que la province, en tant que le gouvernement fédéral, en tant que la Première Nation, pour trouver c'est quoi l'infrastructure qu'on a besoin. Est-ce que c'est des backup generators? Est-ce que c'est une ligne de transmission? Si oui, c'est une ligne, qu'est-ce qu'on doit faire? C'est quoi la route? Toutes des questions comme ça. Mais je pense qu'on dirait peut-être que nous sommes aujourd'hui jusqu'au début d'une plus grande conversation où ce que nous devrions examiner, c'est quoi les opportunités pour promouvoir l'économie, les réalités, les faits culturels dans Pimachowak, mais aussi des sources d'électricité.
Merci beaucoup. Bonne journée.
Bonne journée.
And up next from Canadian Press, Steve Lambert.
Oh, hi, Premier. Again, on Pimachowak, there's been talk of bringing in a portable water treatment plant. It's something the community is looking at. In terms of the immediate next few days, is there a role for the province in that issue, on that item or other items?
Yeah, thanks, Steve. We will be happy to help as we have been up to now. Just as a bit of context, and I'm sure you heard what I was very roughly trying to say in some, butchered French there a second ago. But if you look at what happened immediately following the power outage in Pimachowak, you have the incorporated community of Cross Lake. And their water treatment plant did not lose power because they had a backup generator. And then we as a province, alongside great local leaders on both sides, but also in the incorporated community, we brought in an emergency industrial heater. And they used that to turn the local cadet depot into a warming shelter. And between then and now, at least from the last update that I got, the water plant that we were able to keep online has been serving not only the incorporated community of Cross Lake, but also Pimachowak Cree Nation. And so we as a province, we've been there, we supported the call for the armed forces, we will continue to be there through these additional needs as they get identified. I welcome the fact that the Canadian Armed Forces are on the ground today. We got a lot of people heading up north, many people already there. I had a chance to speak to a lot of the blue-collar tradespeople who are already hard at work when I was in community, and we're going to continue to be there. There is going to be that conversation about bigger picture, longer term fixes, but for right now, when you're in an immediate recovery stage, it's important that we all work together. And so in addition to working with Chief Monias and having that coordination with Mayor Smith, we've been working with the federal government as well. And I was happy to be there with our federal counterparts, but also talking to different federal ministers in the days that followed, just to make sure we're all on the same page and helping out this community that went through a really tough time and continues to face some challenges.
And again, recognizing that, the feds are responsible up here. But in terms of the need for tradespeople, is there any help coming? Is there a role for the province there, reaching out to other provinces maybe, and the dire need for tradespeople in the immediate future?
Yeah, I think from the early days of planning for recovery, I'm talking about before December 31st, 2025, when we were just looking ahead to, okay, Manitoba Hydro has this target time for energizing different parts of the community in a staged order. Right from there, we were bringing forward the different resources for tradespeople to help ensure that ISC, that MKO, that Pimachowak would be able to have the forces on the ground, that frontline human resource on the ground to be able to do the repairs and the assessments needed. I can tell you that having been there last week, it sounds like you're there now maybe, there were a ton of people on the ground. I understand that more people, including the Canadian Armed Forces folks, are there today. And I think what we're looking at is more about turning to the private sector. It's about getting the Red Seals and the apprentices. It's about getting the contractors and the businesses up there to help with the rebuilding and repair and return home for people in Pimachowak. It was great to see people from those private sector employers in town when I was there last week, from communities like Thompson and New Bothwell and Steinbach. And now I understand there's many more people from Winnipeg and other Western Canadian cities, either there or on the way up. So just want to thank all the folks who are helping with this big project of trying to get some 1,300 households into a position where people can return home. Or making sure that they are. Again, some are ready to return, but we got to do some repairs on some others, just to be clear. Okay, so I think that was it for Zoom. So we could.
Yeah, I was just going to ask about Pimachowak with the military being there. How did you feel about how do you currently feel about the process being made?
Well, I just want to see people be able to return home. I think that's the best situation. You know, people are frustrated on the ground. While you and I were getting ready to celebrate the new year, you know, folks there were working around the clock to preserve homes. People were having to move out and spent a lot of days in some cases out of the comforts of being there at home. But people are resilient, and the armed forces have the best of the best when it comes to the logistical planning. And, you know, I think a lot of that's what I saw there is needed. You got a lot of good, hardworking people in Pimachowak and Cross Lake. You had the mayor of Cross Lake actually working heavy equipment as part of the recovery effort. You got the chief and council of Pimachowak there in the public works building right on the front lines as well. So people are stepping up. And I think, if anything, and why I supported the call to bring in the Canadian Armed Forces, was that CAF has that logistical ability to just triage, assess, coordinate, and then deploy. Because we got a lot of resources heading into the community. Let's just make sure they're coordinated so people can go home soon. Yeah.
En français, s'il vous plaît, regarding Mr. Albert and his comments.
OK. Bien, ce matin, je parlais au gouverneur de l'État de Minnesota, M. Walz, et puis j'ai donné notre appui en tant que la province du Manitoba. Et puis je lui ai demandé qu'est-ce qu'on pourrait faire. Et il a dit, hey, les Manitobans, les Canadiens, tu devrais utiliser tes voix pour appuyer notre État, pour appuyer les États-Unis. Alors, oui, je vous encourage, les Manitobans, les Canadiens, d'utiliser votre voix pour appuyer la justice dans l'Amérique, mais aussi dans l'Amérique du Nord. Et puis, quand on voit quelqu'un dans notre province qui essaie de faire des blagues ou quelque chose sur Facebook, ça juste vous montre que les conservateurs progressistes dans notre province ne sont pas prêts pour travailler dans le gouvernement. Ils sont là pour leur Facebook. Nous sommes là pour la démocratie.
And 2 minutes ago, Bobby Kahn just posted that Allard will be a candidate and has been suspended from the Congress.
Yeah, they're here for Facebook. We're here for democracy.
They did suspend him.
Well, we'll have to see the press conference. All right.
Thanks, folks.